Vagus nerve, it's all the craze right now. And you've done a Google search to figure out what is my practitioner talking about? What is my friend talking about when they had mentioned the vagus nerve? And you probably Googled and come across millions of research articles or blog posts about the vagus nerve. Well, the vagus nerve is this incredible nerve that is linked to and tied to gut challenges and immune challenges. And when it comes to the patients that we take care of in our office, we see this all too often, specifically a gut issue or a immune challenge that is really tied back to what the root cause really is, which is vagus nerve dysfunction or dysregulation. So I'm Dr. Devin, I'm a pediatric chiropractor. In this video, we're going to break down the relationship between the gut and the immune, or the gut and the brain, right? So if we dive into this and we look at what is really going on, we have to include the vagus nerve. And the vagus nerve, it is nicknamed the wandering nerve because it is this beautiful cranial nerve or brain wire that leaves our brain. It exits the skull and it passes in front of the top two neurovertebra in our neck, and it goes into our lungs, our heart, our upper GI, our lower GI, in addition to all of our oral fascial senses. So what we're looking at is specifically is, are we regulating those autonomic processes the way that we could and should be? Whether it's constipation, diarrhea, gassy, bloated, or chronic congestion, or immune struggle, or allergies, or rashing. Why is it? And if you tried supplementation and dietary changes and all the things, you may have stumbled across vagus nerve. So one of the things that we do in our office is we measure the tone or the function of the vagus nerve through what's called heart rate variability. And I'm going to show you here in just a minute an example of what that looks like in two of the patients that we've taken care of, both a 2-year-old and this 2-year-old's mom as well, and the stark differences that really show up when the vagus nerve is disrupted. Well, you may be asking yourself, well, how does the vagus nerve get disrupted or dysregulated or become dysfunctional in the first place? Well, what we see most often is through stress of life, whether it be as a baby, right? Through the birth process, birth trauma, forceps, vacuum, manual assistance, pulling on the head, the upper neck, which will interrupt the delicate circuitry that exits the brain and passes, like we said, in front of the top two neurovertebra in the neck, which will impact the vagus nerve. So a newborn may show up having challenges with eating, sleeping, or pooping because the vagus nerve is designed to relax the system down. Or it may show up through that first year of life, going through the normal childhood developmental stages, going from horizontal to now vertical and being upright and walking, and all the physical stress that may ensue as we go through those steps. Or it may show up on us as adults in complete exhaustion because we're sitting so long in front of a desk, that we're looking down at our cell phone constantly, putting a lot of strain and stress on the head, on the upper neck, impacting the vagus nerve. So when we look at these neurological scans, and I'm going to share my screen here in just a second to show you exactly what these look like in our office, there's two scans that I want to show you, which is this 2-year-old girl, right? And what we're looking at, what we're measuring is the tone, the quality of the vagus nerve through what's called heart rate variability. This is the standard of measuring the function of the autonomic nervous system as a whole. And HRV is the standard to show us what's really going on the inside. So this first scan I'm going to show you here on the left side, labeled number 1, what we're looking at is the quality of the autonomic nervous system. And you may have, if you've never seen one of these scans before, what we want to see is this white dot plot somewhere here high up in the green zone. This is where the healthiest individuals live. This is where the vagus nerve is doing its job. It's running its autonomic processes in a efficient manner. So what we see on this scan, specifically with this 2-year-old girl, is her white dot plotting significantly lower than it should be. This is why this 2-year-old struggles with, in a big way, chronic ear infections, chronic constipation, not sleeping well, and gross motor challenges as well because the nervous system as a whole, it's exhausted. So on this scan, what needs to happen is we need to get the activity, the reserve, the battery charge to the vagus nerve significantly higher so that these chronic challenges no longer exist. And this is in stark contrast, like I mentioned, to this HRV scan over here, which is this 2-year-old's mother, right? And we know, being a parent, that there is so much stress, and that's what's showing up on her nervous system. Well, it's not to the point of complete exhaustion because she's doing all the things, eating well, she's exercising, she is doing supplementation and things like that, but her system plots significantly further to the left, which is called that sympathetic nervous system. So she's high up on there, but her system is so far out of balance in the sympathetic, that fight or flight side, that she's struggling with GI challenges. She's struggling with sleep challenges. She's struggling with sciatica challenges as well because the nervous system is not regulating to get into that calm, relaxed, healing, digesting state. So we can see and we can measure exactly what the quality of the nervous system is. Where are you? And to bring some clarity as to why you're dealing with the struggles that you are. So this is one of the steps that we take in our office to see exactly what is the quality of your nervous system. Measuring is the first step. So if you're somebody that suspects that you may have vagal nerve dysfunction or anything that is around what we just talked about as far as a GI challenge, an immune challenge that is not going away, there is something that is underlying that has not been addressed properly. This is why doing these neurological scans is so important, to see exactly why are we not moving through the challenge, the struggle, like we could and should be. So from there, after we do these neurological scans, we're also going to do an in-depth consultation and move the conversation then to a actual care schedule, care plan, to work you through your challenge or struggle. So if you have any questions about anything we just talked about today in revolving around the vagus nerve, revolving around care in the office, please do not hesitate to reach out with us. We're going to include a couple articles explaining a little bit more in depth about the vagus nerve and how it is connected from the brain down to the GI system, and how that then influences our response to environmental factors, whether it be bug, pathogen, or foods, that our system should be in a state of acceptance to meet the challenge, break down the food, eliminate the food, or if it's a bug, a pathogen, to fight it off with relative ease. If you're somebody that's struggling with any one of those challenges, please do not hesitate to reach out. Otherwise, I look forward to seeing and talking with you all in our next video. Take care.